This module of Acessa U will go over the fundamentals of radiofrequency ablation and laparoscopic ultrasound. We will begin by discussing electrosurgery at a basic level. This is a monopolar energy source where we use electricity in a localized fashion through a needle electrode. The heat that is generated spreads by conduction and then falls off rapidly in a defined manner equal to 1 over the distance to the 4th power. This is why we maintain a 1 centimeter zone around the electrodes out to the fibroid capsule. The further distance from the energy source, the lesser the heat. This is what contributes to the safety. Similar to other monopolar devices, the energy returns to the leg pads. Here is a demonstration of the heat spread during the Acessa procedure. At the temperatures used in the Acessa procedure, instantaneous cell death occurs. There is no post-UAE syndrome, the difference between coagulative necrosis and ischemic necrosis. This procedure refines radiofrequency technology to be used in a volumetric fashion rather than for focal use, like with hemostasis. Fortunately, the developer of Acessa, Dr. Bruce Lee, has thought about how to take advantage of this effect to calculate how to treat from a three-dimensional perspective and apply it to fibroids. The treated tissue is not excised but absorbed. This absorption may be partial or complete. Monopolar electrosurgery used in this manner is not a new technology. It has been used in general surgery for years. The Acessa procedure involves the use of laparoscopic ultrasound, which is also not new. This modality has been used elsewhere. It's now time to recognize how this can help us better identify our target. So what are the advantages of laparoscopic ultrasound in GYN surgery? It allows us to get closer to the tissue that we want to see and requires less tissue penetration to do so. It provides better resolution of fibroids with direct contact to the uterus. Now we can see more fibroids in better detail, as well as see those deep intramural fibroids not readily seen by conventional laparoscopy. You can think of laparoscopic ultrasound compared to transvaginal similarly as you would think of transvaginal ultrasound compared to transabdominal for the exact same reasons. You're closer to the tissue using a higher megahertz and can see detail with greater clarity. RFA is not new. Acessa uses laparoscopy and ultrasound. Put it all together and you have a procedure that can treat virtually all the fibroids present. Acessa uses standard skills that you already have, taking them to another level. Anyone who has symptomatic fibroids and no contraindications for laparoscopic surgery is a candidate. Here are the special generator and handpiece. Seen here is the OR setup with the monitors for the laparoscopic ultrasound and laparoscopic view side by side. This allows us 2 different ways to simultaneously image the same anatomy. Let's talk about ultrasound. Fibroid mapping is an integral part of the Acessa procedure. But what does this mean? In the Acessa procedure, you use the laparoscopic ultrasound to systematically locate each fibroid, better than what is seen with MRI. The ultrasound also functions as a manipulator and stabilizer of the uterus while the procedure is being performed. Laparoscopic ultrasound allows you, the surgeon, to detect more fibroids in every category compared to MRI and transvaginal ultrasound. The benefit is that if you can identify the fibroids, you are able to treat the fibroids.